Yeah, it's interesting when people ask me about the symptoms I had, and the ironic thing is I had none. Matter of fact, it was in early 2020, my doctor said, go get an EKG, you're at that age, just get one anyway. And sure enough, I was an AFib.
Well, so all heart conditions are potentially serious, but he has a very common condition called atrial fibrillation, but it's not something to be taken lightly because the consequences can be a stroke. I was able to call up and communicate with my colleague, Dr. Al-Sheikh.
At that point, the option was catheter ablation, which is basically going inside the heart with a catheter, find those electrical circuits that are not normal, and cauterize them, if you will, or ablate them, and maintain the rhythm.
I could have had a stroke, and that's unnerving, right? When you're walking around almost like ticking time bomb. It might not have happened, but it might have, right? The fact that they jumped on that issue and dealt with it was, again, really important to me.
The people just made you feel comfortable. They made sure I knew everything that was going on, so I was not worrying in the waiting room. I would have to say just the level of communication was the most comforting thing there. I didn't have to worry.
We got to experience the care firsthand, right? Unfortunately. But because of that level of service, because of that level of care that we received, we get to pass that experience on to others. So not only do we do go there for all procedures, we also committed some resources there because we want the Baptist Hospital, the new Baptist Hospital, to be the best ever.
Our group, which is now made up of over 27 cardiologists, communicates. It all boils down to the same thing in your business and my business. It's communication and working together. We're very excited about the new facility because the new facility is designed to make that teamwork even better.
Baptist Hospital had the first heart rhythm center in the region more than 10 or 11 years ago. In the area of electrophysiology, we were one of 8 centers in the nation to be the first to receive the IAC Intersocietal Accreditation Commission approval of meeting highest standard of care in every area of electrophysiology care. We're very excited to have the new facility. I don't expect the level of care to improving much because we take a lot of pride with the level of care that we think of it as the best possible care that could be delivered to the patients. But it will be, I think, much easier to provide the care in a more efficient way. It's time to have the physical appearance with all its beauty to match the beautiful culture Baptist has, the outstanding care we are known for.
The new campus is going to be a showpiece for Pensacola. When you come down I-110 and see that campus shining there and on that spot, it's going to be really important for visitors and tourists and residents alike to know that that facility is there, and we wanted to be a part of that. In our community, we should be one of the richest places in Florida, right? But we have a lot of people underserved, underprivileged, and Baptist is there for them.
I've heard the word transforming healthcare in the community. The way I look at the new facility providing that is really through providing better and wider access to more patients to receive the care that we take a lot of pride in providing.
Because of your philanthropic gifts to the Baptist Healthcare Foundation, we are able to provide groundbreaking care to our heart and vascular patients like John. Join us as we continue to transform Baptist for the future. For more information, visit baptisthealthcarefoundation.org.